Thank you for having me. I am a proud volunteer of the Alzheimer Association. I'm a certified Alzheimer and dementia care trainer. I work with families that are in transition with their loved ones and basically teach them how to communicate and live the best lives that they can with the disease. I also help families that don't really have a comprehensive action plan when something that is unforeseen happens with their loved ones. But I'm very happy to be here with Nicolette, and we can get started with Living with Alzheimer for Caregivers Part 2. All behavior is a way of communicating something. Types of behavior changes include confusion, repetition, agitation, and aggression, hallucinations, delusions, sleeplessness, sundowning, unpredictable behaviors. The repetition for me is definitely something that we had to face in our family, and it could be very trying to families. And there's a couple of tips that we'll discuss that sometimes help modify the repetitive behaviors. But let's see what Kitty's husband, Bill, who was diagnosed, has to say.
Bill's diagnosis of Alzheimer's has created opportunities for us to develop strategies to live with it again rather than to die from it. Some of our coping strategies, some of them are funny and some of them are very, very real. Every single morning we make lists. Now sometimes only 2 things get done on the list, but we make lists so there's a plan and there's a program for the day. That's very, very helpful in knowing I have things that I need to do. And I work outside of the home and Bill is at home by himself. So we have to be very organized because he actually does need the structure and he does need the dependability. And in our kitchen, we have duplicates of almost everything so that and we know now if it's lost, it's probably on top of the cat box because for some reason that's where it goes. We don't know why though. So, and we have a lot of different, we have extra sets of keys everywhere. We have extra sets of glasses. And that's so that no one gets upset or angry or frustrated. And those are the things we're trying to meet the disease right where it is. Some days it's where everything's lost and we can't remember everything. We also have pads of paper next to each telephone. We also have pencils everywhere so that even if you only have the thought for one moment, you can write it down. That's been very helpful. Sometimes we find notes and we don't know what they mean, and that's okay too. But we've learned to meet the disease right where it is now, and maybe next week we'll need to have another coping strategy. But these are working.
I love what Kitty said, to meet the disease where it is. I think that's so important for all of us to remember. I think sometimes we get very hopeful when we have good lucid days and our loved ones seem to be right on track, but we have to be mindful that that's part of the journey. And sometimes we do have those days, but the next day could be a complete blank or a blur. Confusion about people, places, and things is common. Respond with simple statements. Remember that your support and caring is felt and appreciated. That was a big, big component for my family and for my uncle, who is still with us, very, very progressed dementia. And it was very hard for my mom and his other siblings, to understand and how to respond to his statements. A biggie was, he was fixated for some reason that his mother, who has been gone 50 years plus, was coming to pick him up. And his brother, my other uncle, would always want to argue and try to rationalize, Mom is dead, Mom is not with us. And, it took some time to finally get him to not say that and just kind of go with it. I remember one day he was very agitated. His mom was picking him up. He didn't want to be late. And basically, I just kind of came in and said, okay, well, what time is your mom picking you up? And he said 3 o'clock. I said, fantastic. It's only 12. Let's have some lunch. I'm going to put all your stuff. I took a coat out of the closet. I put it by the door. I said, you'll have everything. As soon as your mom picks you up, you'll be ready to go out the door. and off we went. He did not repeat it. He was done. I think we forget that sometimes that's what they need. Martha Tierney is a social worker and is a team lead with the helpline at the Alzheimer Association National Office.
The emotional need behind the question, when am I going to go home, is often more about the fact that the person feels like they're in an unfamiliar place. They're feeling disoriented, and they want to get back to a place that feels comfortable and where they know what's going on. They may be at home, and still they say, I want to go home. Creative fibbing is about responding to that emotional need behind that question. You've probably already responded and tried to explain, Mom, you are actually at home. It's okay. Remember, you live here. Here are your dishes. Remember when we bought these? And that's backfired. That seems to upset Mom more. Because in Mom's mind, she is not at home. This is not familiar, and she wants to go home. So the more time you spend trying to explain to her that she is home, the emotional experience you're giving her is the feeling that she's wrong, you're not listening, and that she's not going to get what she wants. Instead of explaining that she is home, you can shift to a creative fib where you're tending to the emotional need. She's feeling disoriented and confused, and things around her are unfamiliar. So she'll say, I want to go home. When are we going home? And you'll say something like, you know what, Mom, I think we'll stay here tonight. I'm going to be here with you. We're both safe. Let's go over here and work on this project. So you've validated her feeling, and you've reassured her that she's safe. And then hopefully you've redirected her onto something else. It's very possible that she'll keep asking again, but if you stay steady and keep your response general, she'll feel reassured.
That's definitely a wonderful tip. And we too experienced that with my uncle. And something that happened to work for us is that when he would get very, very agitated about, I want to go home. This is not my home, even though it was his home. And something that I believe intercepted that repetitiveness and that agitated state was getting him in the car, going somewhere, doing a quick little chore, pickup or an errand, and then coming back. And before we got there, said, we're going to get home. And usually he would say, well, I hope you find a parking spot. And that also was something that helped our family with him fixating that he wasn't home. Repetitious behaviors. Use brief, simple statements. That is huge. Keep a calm voice. Use simple written reminders. Distract with a favorite activity. Remove triggers from the environment. Look for special meaning in the behavior. And of course, consult with the person's physician. Remove triggers from the environment. I'd like to touch on that for a little bit, because one of our biggest challenges in our home with my uncle was that he wanted to drive. And that was obviously not even a possibility. So we literally, out of sight, out of mind, had to remove the keys. And then we had to also disperse of the car. Once those two things were removed from his home and from his, where he can see it, that made a world of a difference for our family. Agitation and aggression can be due to fatigue, changes in sleep patterns, experiencing pain, medication reactions, impaired vision, hallucinations or delusions, or loss of control of inhibitions. Sleeping patterns definitely was, and it seems to be very prominent. And that's something that you have to tackle immediately. If they start sleeping during the day, the probability of them being up all hours of the night is pretty darn a sure shot. And as caregivers, it's exhausting because we're done. We're done with the day that we had and we want to go to bed. So I highly recommend, if anybody sees a little bit, a cat nap here and there, that I'm not opposed to. But if there's large hours of the day that they're napping, especially anything after 3 o'clock was our that was our timeline. No, 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 no. We cannot be taking 3 hour naps at 3 or 4 o'clock in the afternoon because we knew that that was going to alter that evening. So always be conscious of any changes like that when with naps and sleeping. Hallucinations and delusions. Work with the physician to rule out other causes. These symptoms are often a part of the disease. Assess the environment for triggers. Some symptoms may be harmless, while others need intervention. The person with dementia cannot control these behaviors. Dementia has changed the way the brain functions. And I think that's a wonderful reminder. I think in this process and in this journey of dementia, what's so difficult is that the people that we once knew are physically still the same. And it's the behaviors that are coming from the dementia that has absolutely changed the way their brain works. Persons with dementia may become suspicious of those around them, accuse others of theft or infidelity. To respond, don't take offense. Do not argue. Offer a simple answer and always try to shift focus. My uncle definitely became very suspicious. He became very, very paranoid. He wanted his checkbook at all times. And, it was fine. We knew that if he wanted to write a check, we actually gave him voided checks, but it definitely helped him regroup and de-escalate the agitation. Beverly's husband, Amos, has a diagnosis of Alzheimer's disease. I love Beverly. Let's listen to what Beverly has to say.
People often ask what sundowning is, especially when I tell them that he gets his sundowners about 2 o'clock in the afternoon. There is something about the evening hours when their behavior seems a little different. It's the time when he says he's going home. It's the time he says that he's looking for his wife. It's the time when he wants to leave. He's very disoriented when afternoon comes or when evening comes. And I think a lot of it is because he's very tired. He's had to think. He's had to put on this show for whomever all day long, so that by the evening, everything is just in disarray. He has trouble even walking sometimes in the evening if we've had a busy day. So they call it sundowners because most of the time it happens when the sun goes down.
Yes, definitely sundowning can be very, 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 very challenging for families. Sundowning is confusion and agitation, beginning in the evening, continuing through the night at times. Strategies to try is to have the person set up a quiet place with an activity prior to people returning home. Keep evening meals simple. Keep lighting bright. Allow supervised pacing. Discuss medication with a physician. Definitely the last one is important because if that becomes a almost like a habit behavior, then that is just not a healthy situation for the person with dementia or the family, the caregiver, the family, the people in the home, because we just can't function if nobody's sleeping in the evening. My uncle really quickly, he had something happen and he completely got his nights and days confused and wanted to make breakfast at 3 in the morning. So it was very, very challenging. It took us quite a few days, and we absolutely had to reach out to his primary physician to definitely give him a little bit of something. I believe it was Lunesta, just to kind of help him go to sleep. Sleeping changes and interventions. Changes are often due to medical or environmental causes. Get a good medical workup. Use medication as a last resort. Maintain an active day time schedule to help avoid daytime sleeping. And I think we discussed that a few moments ago. Very important to keep a structured schedule, and definitely nothing after 3 o'clock. Nobody should be taking long naps at that time. Unpredictable behaviors. The person with dementia may exhibit sexual bold behaviors, dressing or undressing at inappropriate times, even shoplifting. That could be very, very challenging on families. And, you know, one of the things that I was very open about is if I went into a store, he never ever wanted to take anything, but he did want to buy everything. But we made it very clear. I just felt much more comfortable telling a store clerk, hey, by the way, the person I'm with has dementia. So if, you know, any repetitive, I'll take care of it. And people were very, very receptive of that. They appreciated it and actually were very accommodating to us. Nicolette, I don't know if we skipped a few others, or are we? I'm on FDA approved. Okay, so that's the next one. Okay, no, we got it. FDA approved treatments. There are several different treatments available that can address some symptoms of Alzheimer's disease. Aricept, Exelon, Razidine, Namedenen, and Amazarac. I always have a hard time pronouncing them, so I apologize. These treatments work in varying degrees and are not effective for everyone. Always talk to your doctor whenever considering treatments. Discuss potential side effects, etc. The Alzheimer's Association Effective Communication and Understanding and Responding to Dementia-Related Behaviors programs offer an in-depth information on managing symptoms through behavior and communication interventions. I can't stress enough of treatments are wonderful, medication is wonderful, but somehow we forget to discuss the potential side effects. And I think as advocates for our loved ones that have dementia, it is absolutely important that you ask those difficult questions. What are the potential side effects? Medications to treat behavior systems. Maria Carrillo is a PhD, is Vice President of Medical and Scientific Relations at the Alzheimer's Association National Office.
There are many options for treating people with behavioral issues in the middle or late stages of the disease. Many of them do include non-pharmacological approaches that should be discussed with physicians and with caregivers. But sometimes there are some behaviors that just cause difficulty or danger to the person who has Alzheimer's disease or their caregivers or those around them. And sometimes that means a family must resort to talking to their physician about antipsychotic treatments. They should be used as a last resort. They should not be used as the primary source for changing behavioral disturbances, but are available for those families who feel they just need to have them.
Safety concerns in the middle stage. Home environment. Assess for fire and electrical risks. Install guards on cabinets containing cleaning fluids, etc. Clear away loose rugs and floor clutter. Absolutely. That is so important to really survey your home, and especially the person that lives in the home that has dementia. It's so important to remember to clear away anything that you could be a trip hazard. I know for my uncle, he would look up and he just was not aware all the time of his surroundings. And he was always tripping. So we definitely had to rearrange, redecorate, and get rid of, coffee tables, side little tables, because it was too dangerous. Safety concerns in the middle stages, again, activities, balance safety and autonomy. So, simplify activities, assist with decision making, set up plans to cover potentially dangerous scenarios. Definitely the last one is very close and dear to me. What happens if something happens to the caregiver? You have to have a plan. And to me, it was very important to let my neighbors know that my uncle had dementia. He definitely was confused most of the time. He was absolutely not allowed to drive. He couldn't drive. And the reason that we felt we had to share with our community is because sometimes he presented beautifully. And why wouldn't someone not believe that he couldn't drive? Again, he was, all his extremities, he was very mobile. Again, that's one of the camouflage, if you will, of dementia or Alzheimer's. The person still looks the same. It's cognitively that things are very, very challenging or different. So having a backup plan for anything, even, if God forbid the caregiver fell, how am I going to call someone? Because don't think improbability. My uncle would not have been able to call 911 if my mom or his other sibling, which were his caregivers, fell and injured themselves. So having a plan is very important. Driving. Good judgment and quick reaction time are needed to drive. As the disease progresses to the middle stage, the person is less able to drive safely. Deciding that it is unsafe for a person to drive is very, very difficult. Safety, though, has to be a priority. Make other plans of transportation. I think I talked about it a little bit earlier, is out of sight, out of mind. We did have to remove keys. We did have to remove the car. Because he was insistent that he can still drive. And I know I've shared this in other presentations, but what broke the camel's back in our family was, I'm originally from Jersey City. My uncle lived in a lovely brownstone in Jersey City by St. Peter's College, very narrow street, both parking on both sides, very different than where we live now. And he literally hit 17 parked cars, 17. There were 17 police reports. He didn't even flinch. He did not even know he hit the cars. This was like when really things were starting to unravel with him and how quickly he progressed. And that was it. That was one of the beginning. No, you are not driving anymore. And it was very difficult. There are ways of contacting the Department of Motor Vehicles. It's very hard to find on their website, but if you look at one of the tabs, it's a pull down, and it's very simple. You don't have to be the culprit per se, but you do let them know what's happening, especially if it's a confirmed and diagnosed by a doctor. They will send a little form, and basically they take away the driving privileges. And we are going through this right now with another uncle that has dementia, and he has to go take a test again. They retest them. It's very simple. Now, it's not simple for us because sometimes they're not understanding that they have to go take a test, or they're not understanding that, no, you didn't do well on the test, you no longer can drive. But it's a very challenging time, but absolutely safety has to be the number one priority, because if they don't hurt themselves, God forbid they hurt someone else. Signs of unsafe driving: forgetting how to locate familiar places, failing to observe traffic signs, driving in an inappropriate speed. And I'm going to stop on that one for a little bit. That does not necessarily mean that they're driving too fast. It's also a violation, if you will, or inappropriate speed, is if you're going 10 miles an hour in a highway that's 50 miles an hour. That could be very, very dangerous for other drivers as well. Becoming emotional, hitting curbs, displaying poor lane judgment, confusing the brake and gas pedals. So many people. If I had $1 for the folks that have realized, okay, no more driving because the car was in the driveway and mom got confused of gas and gas and brake, and hit the gas and went through the door, the garage door. So those are definitely red flags that person should not be driving. Kathleen's husband, Boyer, has a diagnosis of Alzheimer's disease.
He had driven all his life. He was a cab driver, he was a bus driver, he did all kinds of driving. And his driving really got very, very scary. It was not just getting lost. He just didn't see the lines in the road, and he would go way over them, and he'd be driving on the edge. And so the doctor said, you shouldn't drive anymore. And of course, anyone who has a loved one with Alzheimer's knows that this is probably the worst thing they'll ever hear.
It absolutely is. I think the reality of it too, it's yet something else that is taking away from us. I also believe that there has to be moments when the person with dementia or Alzheimer's realizes, like, wow, I can't even do that. But at the end of the day, again, we are the caregivers, we're advocating for them, and our role is to keep them safe and ourselves safe. I have many, many spouses that are terrified to get in the car with them, that their loved ones, with their spouse, and it's time to get rid of keys. And at times I tell adult children, get the car out of there, because this is going to be a problem. Tips to stop driving: let others do the driving, be firm yet positive about driving, solicit the support of others, use authority figures to reinforce the message, experiment with ways to distract the person, be prepared for driving related wandering. That was a huge one, a really quick and scary story. My friend's dad was in the beginning stages of dementia. And unfortunately, that's what we don't know. Sometimes, yeah, in the beginning, like one of the people that spoke earlier with the lists and stuff, they still can do certain things for themselves. But unfortunately, with this disease, things can change very quickly. And my friend with her dad, he had gone to the store and he totally forgot where his car was, where the keys were, all of the above. With a grocery bag, he walked 5 miles from where he parked his car. Didn't know where he was, didn't know until finally, by the grace of God, a police officer was like, where is this gentleman going? And luckily, that's how he was, saved. It took quite a few hours, scary hours. Police definitely knew that the car, my friend had to call the police. They found the car, but not the person. And he was 5 miles from where he had parked the car. So a very scary moment for that family. What if the person won't stop driving? That's a huge question and a huge challenge. Control access to the car keys. Disable the car. Consider selling the car. Keep the car out of sight. Write a letter to the State Department of Motor Vehicles. I think we covered that just with my little story about my family. But yes, I think I'm a firm believer, out of sight, out of mind. Firearm safety, sorry. The person's past experience with guns does not ensure current safety. Locking or disabling a gun may be the first step. To fully protect everyone, remove all guns from the home. Absolutely. This to me is just very simple. That has to be removed. That, I don't care what kind of hunter, I don't care how wonderful and how great they were with the gun, before the diagnose. This is safety for everyone. And so, in my opinion, firearms must be removed from the premises. Making alternate plans for weapons. Discuss the issue with the person as early in the disease process as possible. Enlist help with necessary personnel. Decide how to store, pass on, or dispose of the weapons together whenever you can. This one's huge because I do think that that's very important. I think discussing the process in the very beginning stages, when the person is exhibiting minimal signs of dementia, is better. I do not recommend having this discussion when someone is, for example, like my uncle, moderate to advanced stages, because I think it could be a trigger conversation, no pun intended. And it's just best that the caregiver and the family stick as a united front and dispose or just eliminate the firearms from the home. The need for supervision. The person with dementia will need supervision in the middle stage of the disease. Resistance is common. You can introduce a companion into the household to help ensure safety. Absolutely. I think there's a fine line between when a person is in the middle stage of the disease and someone in the beginning. And this conversation has to happen. And inevitably, when you are in the journey of this disease and when it's progressed, I think safety and having someone there for them is imperative. Living alone. Some live alone in the early stage into the beginning of the middle stage. Living alone requires increasing degrees of support from care companions, relatives, residential care settings. Preparing for and preventing wandering. Encourage movement and exercise. Ensure all basic needs are met. Toileting, nutrition, thirst. Involve the person in daily activities. Place color matching cloth over doorknobs to camouflage. Redirect pacing or restless behavior. Reassure the person. Yeah, this is usually a huge problem for people that live independently. I definitely recommend they're very inexpensive, and they're little tabs that you put on the door in the event that you're sleeping and it's at nighttime and a loved one tries to leave the home. That's very, very scary. And that's a great way to at least be alerted that someone's at the door. I do like the cloth or a handkerchief or something over the doorknob to camouflage it. Prevent the person from getting lost. Inform your neighbors and local emergency responders of the person's condition. Keep your home safe and secure. Be aware that the person may not only wander by foot, but also by car. I think that every single county has this. If you go to your sheriff's office, there is a way to register, just like we register special needs children, deaf people, or blind people. There is now a way to register anybody that has cognitive compromise, such as dementia and Alzheimer's. It is super important for many phases, because what if inappropriate behavior is happening? Which we talked about earlier in the slides, what if sexual inappropriate behavior is happening outside your home? The likelihood is that the police is going to get called and the police are going to do their job. But if your loved one is registered, we're going to be hopeful that this is disseminated and they proceed and handle that situation differently. So it's super important. Again, I'm a big fan of letting my community, my neighbors especially, know what's going on with my loved one, because what if I'm not around? At least they can advocate for them and say, no, 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 he has dementia. Here's his niece's number, instead of just the unknown variable, like, why is this person behaving this way? Prepare for emergencies. Keep emergency phone numbers by the phone. Keep a list of physicians, numbers, and current medications with dosages. Keep legal documents in secure but accessible location. Check fire extinguishers and smoke detectors regularly. Enroll in Medic Alert plus Alzheimer's Association Safe Return. That's a wonderful resource that the association offers. I highly recommend that it's looked into. And definitely have copies of, don't make just one copy of this emergency numbers, and especially the doctor's lists and medications. That's a biggie, because when you're in a situation of emergency, it's so hard to stay level-headed and to rattle off medication. So I always advise to make a few copies and, distribute them throughout the family. Not only are they in the home, but someone else. With the miracle of technology, it's so easy to take a picture of these lists and always have them on the phone, just in the event that you are not home with them when an emergency occurs.
That's all we have for part 2 today. I know that we are going to do part 3 later this week. Kat, did you want to talk a little bit about the resources as far as the helpline that can help people, or if they're unaware of the support groups that we have?
Sure. I can't speak enough about Alzheimer's Association and the helpline, the website. There are so many resources to be found that it's just really, it's amazing. And the Alzheimer's Association helpline is 1-800-272-3900, 24/7. Along with that, the website itself has so many different reading materials, referrals to different doctors throughout the U.S. and throughout, obviously, New Jersey. It's just a multitude of a wealth of information for everyone that you could do in your own time. Everything is so accessible through the website. Also, if anybody would like to volunteer, there's a wonderful, wonderful site also for the research that's being done, that you can even participate if you qualify. It just is a wealth of information, and I cannot speak highly enough about the Alzheimer Association.
And we have a question in the chat. So a question: sometimes my dad has hallucination that's very upsetting to him and it just breaks my heart. How would you handle a situation like that?
Well, what is the hallucination? If you could give us a little bit more, if you could give us an example. Because when my uncle, oh, there we go. It's in the chat.
And sometimes that someone has passed away.
Oh, yeah, that's a big one.
Or
That's
a dog gets trapped somewhere.
Oh, okay. So you have to reassure. I think one of the folks that we just saw on the slides, sometimes is that fib, and the fib is to de-escalate the behavior. And I'll give as an example about death. With my uncle, he was fixated on my grandmother. And like I mentioned earlier, my grandmother's been dead over 50 years. And my mom would try to rationalize with him and tell him, you know, mommy's no longer here. She died. Remember? No, he doesn't remember. But I would say, like I gave the example that when she was picking him up, okay, she's going to pick you up at 3 o'clock. Great. It's lunchtime. Let's have lunch. Let's have tea, and kind of redirect it. Sometimes, you know, to redirect is to get an album of that person that they're remembering, but then just have that conversation. And I have to tell you this little tip, I haven't had a negative reaction yet, has pacified the person, because that indeed they are thinking, maybe they are thinking and missing the person is no longer with them. And when that album has been brought out with the person, and usually it is in a different time, many years ago past, they start remembering that moment. Oh, this is when we were on the boardwalk, we went for ice cream. And you've exactly done what you've wanted to do, is to de-escalate.
So you have the PowerPoint?
Yes.
I'm sorry?
You know, I did forget to ask you. I was going to ask you.
Oh, okay.
There's so a little bit more context was given about possibly children needing help. Sometimes her dad wants her to call 911 and gets very insistent. He gets quite agitated at these times.
So yeah, calling 911, that's definitely, you're going to have to be definitely very clever. And even if it means dialing somebody else's number, I think you have to have like a family support circle. I know with my uncle, there was one incident. It's funny that you mentioned 911. He was insistent that he wanted to talk to the chief of police. Well, we were not doing that, because we're not calling 911 is for emergencies. So we actually had to call someone else's number, a family member, and he just let it out. I just want to make sure, you know, I've seen a lot of damaged cars. I think that they're vandalizing. He was fixated on something. He must have seen something on the news, and he was interpreting it into real time into his life. And the person who happened to be my other uncle on the phone just listened and said, okay, Dr. Vera, we're going to make sure that we definitely patrol. You rest and go to bed. We're going to patrol very, very late at night when everybody's sleeping. Okay, officer, thank you so much. Done. For whatever reason, he was fixated on that, and, you know, he was demanding to call the police. And that was the only alternative and it worked for us, luckily.
A couple of more questions or comments. So during recent Zoom, so we did have a sleep and braining health with the gerontologist. facility, but I was driving and I couldn't ask questions. So why one of the family members thinks the mother should. So I guess, Kat, I know you work with a lot of families that are in home, but others that are in facilities. We recently had a geriatrician that spoke a little bit about trying to keep people in the home, as long as possible. And do you want to comment? I know it's a really personal decision, but
Absolutely.
maybe positives and negatives on each, or how to kind of weigh that decision.
Absolutely, Nicolette, absolutely. Thank you. It's a valid question. And I think that we do not have a cookie cutter and one size fits all. I think you have to look at your entire family dynamics. You have to see where your loved one is in the journey of dementia. As we said in the presentation, middle stages, they shouldn't even be driving. They shouldn't be alone. So if that's what's weighing things down and nobody is with this person, the only other option is to put them in a safe environment. Let's face it, we live in a society that there's two working folks. 40 years ago, my grandmother, my mom was home, my aunt was home. So she kind of bounced around with everyone that was around. That's not the case. That's not the society we live in. So you have to weigh out your options. Now, I would have to say that there's an increase of concern because of the pandemic, because of COVID. But for the most part, everyone has been vaccinated. For the most part, a lot of facilities, a lot of assisted living communities, a lot of skilled nursing, rehabilitation centers, even hospitals, they've done their due diligence. And things are not exactly like they were pre-COVID, meaning that you have lots of people visiting, but everything is limited and with caution. So you will have a better feel for the community or facility that you visit and tour to make that decision whether you want your loved one there or not, including having the tough questions about visitation, the ratio of caregivers. One of the questions that I do now have to alert families and when I guide them is to ask and say, is this facility, if we were to have another outbreak, if we were to have a crazy spike in numbers again, will this facility go to a hospital and say, hey, we'll take your COVID patients? That's important, because that was one of the biggest things that happened during COVID and it was very tumultuous. It was very contested. Without any warning to the families, there were some facilities that put their best foot forward and went to hospitals. Once people were stabilized, they brought them into their facility. More skilled nursing than anything else. Assisted livings did not do that. And a lot of families were upset with that because they were trying to keep everybody safe and not harmed and not infected. And here we are opening the doors to the hospitals. And we understood why a lot of hospitals in New Jersey were really bursting at the seams. I do not think that's the case now, but as Nicolette said, and I would have to 100% agree with her, this is a personal decision. I guide people to make the educated questions and decisions based on the answers they get to their questions, if this is a place for their loved one. But I can tell you, if your options are that your loved one's in the middle or advanced stage of dementia and they're by themselves, unattended, versus going somewhere safe where they will be fed, they will be compliant with their medications, hands down. I'm a product of that. My uncle has been in a facility for almost 4 years now, because we realized my mother's a caregiver to my father who had cancer, my brother's epileptic. There was no one else to care for him, and his behaviors were escalating. So I have to tell you, he's safe. He got COVID, but he survived. He was vaccinated, et cetera, et cetera. It's weighing out your options and how dangerous is it for your family.
Good answer. I think definitely something that our constituents appreciate and something they have to weigh in on. If there's any other questions, we're happy to help, or if there's anything that you think of later, I'm one of those people, I walk away and think of 5 questions later. I will put in the chat, we have a 24/7 helpline. And it's really great because we have master level trained clinicians, and they are able to help people 24 hours a day, 7 days a week. You can call in the middle of the night and look for resources or information, or just having a bad day and want someone to talk to you that understands. They're available, translated in hundreds of languages. So someone who has a primary other language than English can speak in the language they're comfortable in. So we're here for you, and please come back and see us for the 3rd part of this program, and feel free to bring a friend. I know the library is taking the registration, and we so appreciate their partnership. Is there anything, Judy, Melissa, that we've forgotten or you want to add to the conversation?
I just want to thank Nicolette, the Alzheimer's Association, a wonderful, wonderful partner, and Kat Verdi for this really helpful presentation. I know that it's meant a lot to the people that are here. So I want to thank you all for coming. And again, we've recorded this session, and you will be able to send that out, link out for you to watch it on our YouTube, probably in 1 to 2 weeks. Okay, I don't know, does Kat have anything to say in close, or Nicolette?
Thank you so much. It was a pleasure. Ocean County has such a wonderful resource for their community, and it was a pleasure presenting today. And I want to thank Sandra, who was putting all the little questions on the chat. Thank you so much for being brave, and you know, we all learn from one another, and I'm glad that you took something away from this, and I hope that those little tips work with your dad. And yeah, this is a community, a safe place to share our triumphs, to share our challenges, and learn from one another.
Yes, thank you, everyone. Have a great day.
Okay, take care.
Support public libraries. Like, share, and subscribe for more great videos.